It is now my pleasure to turn today's program over to Charles Gluck. Charles, you may begin.
Thank you. Hello, everyone, and thank you for joining us. I'd like to welcome you to today's Learning Practice event, Practice Portal and CPC Plus Connect. During this webinar, we will review two important tools you will use throughout CPC Plus, the Practice Portal and CPC Plus Connect. Today, we will talk about how practices can use the CPC Plus Practice Portal to access practice information, report on care delivery transformation work, and electronic clinical quality measures that will be available later in the program. We'll demonstrate how practices can use CPC Plus Connect for learning, discussion, and obtaining resources. We'll also spend some time explaining who from the practices should be using both tools. We have some resources available that support both tools, which are available for download, as Matt explained. They will provide further details on using the Practice Portal and CPC Plus Connect. We do have some upcoming events that we'll remind you of, and then at the end of the presentation, we will answer some questions that you have submitted regarding the Practice Portal and CPC Plus Connect. Today, we have Katie Muthukumaran from the National Learning Team and Janelle Jin from the Centers for Medicare and Medicaid Services Innovation Center to share about the Practice Portal and CPC Plus Connect. So, Katie, can you take a moment and talk about how these two sites differ?
Sure, I'd be happy to. So the CPC Plus Practice Portal is a secure website that gives your practice convenient access to your CPC Plus information and enables you to maintain practice and practitioner information for purposes of CPC Plus payment, view payment and attribution information, report your care delivery progress, and submit eCQM data if you choose to submit via attestation. CPC Plus Connect is a web-based platform designed for you and your practice staff to share ideas, best practices, and resources with other CPC Plus participants. Think of this as the Facebook for primary care transformation. The website's easy-to-use features can help support you in your work towards the CPC Plus care delivery requirements.
So we have two sites with very different purposes. Katie, who should be accessing these portals?
So we encourage you to ensure that multiple people at each practice site have CPC Plus Practice Portal access. This will allow your practice to complete requirements and access your CPC Plus information even in the event of staff changes or unexpected absences. Different people will need to perform different functions in the portal. So for example, your admin lead might do all of the practitioner and staff rosters, but your care manager might do the quarterly reporting.
Great, Katie. Thank you for explaining that. Let's begin with a deeper dive into the Practice Portal. And before we do that, I just want to remind you that in Appendix B, C, and D of the Phase 1 CPC Plus Implementation Guide, there is more information on using the Practice Portal. So, Janelle, can you walk through the steps to get access to the CPC Plus Practice Portal?
Sure, thanks, Charles. So as you can see on this slide, there are several steps that you'll need to take to get access to the Practice Portal. And again, they're outlined in detail in Appendix B of the Implementation Guide that you received in December. You can also at any point call or email CPC Plus support when you have questions or to check on your access. The first and foremost step is that a practice contact must submit a list of authorized users at your practice who will need access to the portal. A lot of you have already done this, but if you have not, or if you want to add additional users, please send this list to CPC support as soon as possible. We cannot approve users to have access to the portal unless they're on the submitted list of authorized users. After you get a CMS ePortal account, which is step 2 at the link on your screen here, you'll need to get approval at 2 stages. The first of which is the Request for Innovation Center Application Access. Once you get that, you'll get an email confirming your approval from the IC application approver. After that, you'll then have to request a second access to launch the CPC Plus Practice Portal. At this step, please make sure that you request the practice user role. If you request a different role, as some of you have, we'll have to reject the request and you'll have to start all over again. You'll get another email notification when you submit your request and another when your request is approved or rejected. Only after this step can you move forward with launching the CPC Plus Practice Portal. If you are a participant in CPC Classic and you have access to the web app, you do not need to take any action to get access to the portal. We are still working on migrating all of your data from CPC and from your CPC Plus practice application, but it should be available to you within the next couple of weeks. You will not need to email CPC support unless you want to add different users at your practice. And once again, you can find all of these details and much more in Appendix B of the Phase 1 Implementation Guide.
Thanks. So obviously several steps that must be walked through. If there's an individual that needs to access practice portal pages from multiple practices, can they do that?
Yes. So if your role is associated with multiple practices, you'll be able to access a separate portal page for each practice. You can switch between practices using drop-down menus, which I'll show you in a second when we start the demo.
Okay, great. So why don't we go ahead, if you can begin to screen share and pass the baton to her, please, Matt. All right. So Janelle's going to screen share and walk us through this a little bit. Janelle, can you walk me through what a practice sees after logging in?
Sure. So after you get access, this is what you'll see after the first login, which is the CMS Enterprise Portal. My site might look slightly different from what you will actually see because I'm using a demo site. I didn't want to show any practices secure information on this webinar. Once you're on this page, you'll go up to the top. You'll see several yellow boxes. One of them will say Innovation Center, and this is where you will go. The CPC Plus Practice Portal is hosted in here. Now that I'm inside of the Innovation Center, you'll see different tiles. It will say CPC or CPC Plus. You click on this tile, this square, to launch the CPC Plus Practice Portal. And now I've reached the CPC Plus Practice Portal. And this is where you will see different practices if you're associated with multiple practices. If you're a CPC Classic practice, your default page will actually be the CPC Classic view. You will be able to toggle to the CPC Plus view using a toggle at the top right. I don't have it here because, again, I'm using a demo site. But you'll be able to switch using these drop-downs.
How does a practice know what quarter they're looking at?
Great question. So at the top, there's a year and quarter drop-down. Right now, I don't have any options because we are in the very first quarter of the model. But in future quarters, you can toggle here to see your historic data.
Okay. So I see there's a next tab over is the My Practice Info. Can you tell us what's on that tab? And I think there's sub-tabs with it.
Sure. So let me let it load. So your practice information is stored on My Practice Info, as it is so aptly named. You can see your practice name, your address, and all your primary points of contact. We have migrated the information that you gave us in the practice portal, and this includes clinical leaders, health information technology contacts, and other important details. If you do need to update this information throughout the model, you can do so by clicking on the Update Information link, which I am waving my mouse around right now in the top left and saving the information here.
Okay, great. How about the practice information page? Can you tell us what it shows?
Sure. So the practice information is more information about your practice, different from the demographic information that we just went over. So this is important health information technology details that you told us in the application. If you first log in this week, you may not see your health IT. We're still migrating that particular data, but we will have it soon. And this is your EHR data, your vendor data, a website for your practice if you have it. There's also another form for your TIN and organizational information. This is really important to maintain as changes here need to be approved by CPC support, and so it will take time for us to process. But this is the form when you go to, you'll be able to save it here and then navigate back out.
Okay, great. Can you show us the composition page next?
So the composition page is a very important page, in part because it tells us who your practitioners are and allows us to pay you accurately. There's two sections of the composition page. The first is the practitioner roster. The roster refers to billing practitioners, MDs, DOs, PAs, and NPs. These are people who have an NPI. And these are where we base our attribution off of for your quarterly payments. The second part is the staff roster. This will be blank when you first log in because we did not collect this information in the application. So when you do go in and start updating your information, please do enter your staff roster. We use the rosters to inform our learning, our payment, and our evaluation. So it's important that you keep it accurate and up to date. We will not share it outside of CMS or our contractors.
So I see some tabs there on add and withdraw. Is that how practices update their practitioner and staff rosters?
Yes, it is. So when you click Add Practitioners, it will take you to a different form. This includes a lot of details about the practitioners of your practice, including their NPI, their clinician type, their specialty, effective date. This goes to CPC support for approval, which takes time. So again, I emphasize that we hope that you can update this in a timely manner so that we can pay you accurately and have enough time to do all the processing on the back end. To withdraw a practice, you'd launch from the same practitioner roster. You would select them on this right-hand checkbox, and you would be able to withdraw them using this button here at the bottom of the table. When you withdraw a clinician, similarly, you have to answer some questions and tell us reasons for withdrawal and effective dates. And this will, again, go to CPC support before it goes into effect in your roster.
All right. How about the documents page? Can you tell me what documents are located there?
The documents is your practice's specific documents. So right now, all the letters of support that were submitted in your application will be shown here. Your participation agreements with signatures will also be uploaded here by the end of this week, so you might not have seen them if you've logged in up until now, but they will be there soon. And this is just so that you have a common point of access for all of your CPC Plus documents.
Okay, that makes sense. And what about the practice report page? I called it, actually it's the practice reporting page, sorry.
Yes, let me just give it a moment to load. So the practice reporting page is where you will go to do all of your CPC Plus reporting. As you can see, we don't have any reporting requirements for this quarter, and your care delivery reporting will start in March. There will be a lot more specific details on the reporting questions and the guidance on how to report in the Phase 2 implementation guide coming out shortly.
All right. So no action there. So the next one, the payment and attribution page, I'm sure there's a lot of folks interested in that one.
Yeah, so the payment attribution page has a lot of very exciting details about your CMS CPC Plus payments. It's a one-stop shop for information about your quarterly beneficiaries, the number who are attributed to your practice, the amount of care management fee payments and performance-based incentive payments. You can also see a breakdown of beneficiaries by which risk tier they are in and what the risk score range of each risk tier is. And you can see a running log of the cumulative payments that we have made to you.
Janelle, can you explain the different information that Track 1 would have access to versus Track 2?
Yeah, so right now I'm looking at a Track 1 practice. If I switch to Track 2 using the drop-down menus at the top, I'll give that a moment to load. And again, these are fake practices. And now I can see Track 2 relevant information. So the additional details here are the CPCP percentage that I selected this year, the CPCP payment amount that I received, and you can also see beneficiaries who are associated with the 5th complex risk tier.
Okay, that makes sense. And is it from here or from another spot that I know who is attributed to my practice?
Yeah, so you will be able to download a beneficiary attribution report on this screen, and this will download an Excel file that gives beneficiary level data on your Medicare fee-for-service beneficiaries that were attributed to you for each quarter.
All right, thank you. Can we take a look at the ECQM page, and can you tell me what we're going to see there?
Sure. So while it's loading, I can say there's nothing on the ECQM page right now because we don't have ECQM reporting at this time. By now, you should have selected all 9 of your ECQMs that you're planning on measuring in 2017 and reporting in early 2018 for your quality improvement efforts. You don't have to tell us which 9 you're reporting, but eventually when you do report your data, it will be here. We encourage you to obtain all 14 ECQMs in the measure set and have the capability to report in your EHR in case there are unexpected changes to measure during the first year of CPC+. So there will be nothing here to report until later on this year and early next year. This page is super important even though there's nothing on it right now because ECQM reporting is a requirement to be eligible for the performance-based incentive payment. So I'm sure everyone is very excited about that. There are 2 methods for submitting your ECQMs. One will be through this portal, and we call this attestation, and your attestation will be here. The other method, which would be reporting outside of the portal, is through QRDA 3.
All right. Thank you. And what about the resources page?
So the resources page has several files here that are very familiar to everyone, I'm sure. It's the 588 banking form, the non-DOA tracking form, and the CPC Plus Practice Portal Identity Proving form. These resources will be on the CPC Plus Connect site as well. We just put it here for convenience for you all.
All right, great. And I think these resources are also on CPC Plus Connect, so you have access to them in multiple locations. Janelle, thanks so much for walking us through this. If I can get control back of the slides, that would be great. So one of the takeaways as we do this, after you gain access to the CPC Plus Practice Portal, you'll want to review your practice information, make your updates. So that means updating your practice information, updating your practice roster, your practitioner roster, filling in your staff roster, and working with your EHR vendor to make sure your ECQMs you plan to monitor are in your EHR. And then finally reviewing the Phase 1 implementation guide. There they are right there. And you can download this deck if you need to go back to for review. So we're going to move on now and turn our attention to the CPC Plus Connect. As a reminder, the CPC Plus Getting Started Guide and the Connect Quick Tips have been posted for you to download for this site as well. So Janelle, if you can begin to screen share your screen. I'm sorry, I said Janelle, but I meant Katie. Apologize for that. Can you walk us through how users get started and get accessed? Matt, if you can give her screen sharing.
Yeah, absolutely. So CMS will provide CPC Plus Connect access to all CPC Plus participants, including practice, payer, and health IT vendor participants. Participants should receive an email notification from the CMMI Connect Help Desk this Monday, January 30th. And this email is going to provide participants with their CPC Plus Connect username, a temporary password, and a link to set up their password for the site. It's important to note that participants need to log into CPC Plus Connect within 24 hours of receiving this link, as the temporary password is only valid for 24 hours. If participants miss the window to activate their account, they should email the Connect Help Desk at CMMI Connect Help Desk at cms.hhs.gov to reset their password. So to basically log into CPC Plus Connect, you're going to go to this web address here, which is going to be located in that email, and you're going to enter your username and your password, and then you're going to click Login. And then you're going to be taken to your homepage, which is known as Chatter. And I just want to note here, if a CPC Plus participant is also a participant of CPC Classic, they should note that each community has its own login page. So they'll be taken to the home page of the community that they logged into. But they can switch communities after logging in without logging out.
Okay, thanks for clarifying that. Katie, what are users able to do in CPC Plus Connect?
Yeah, so as we mentioned before, CPC Plus Connect is the online information resource and collaboration site for model participants in our learning community. So CPC Plus Connect is a centralized location for CPC Plus resource documents such as FAQs, webinar slides and recordings, current guidelines, valuable tools, things such as that to help practices comply with the model. Additionally, participants can use CPC Plus Connect to share ideas, links, and resources, best practices, challenges with other CPC Plus participants. They can also join groups and view and register for upcoming learning events.
So that's quite a lot of different opportunities available for folks to leverage their experience. But what if someone has logged in? Is there a profile that they need to set up?
Yes, so participants should set up a profile containing information about themselves and their contact information to enable other CPC Plus Connect participants to get to know them better. So to set your profile, you're going to click on your name up here in the left-hand corner. And then you're going to click the little pencil right here next to contact. And a little pop-up appears, and it says Edit Profile. So here you'll click the About tab, and you can enter information, personal information, first and last name, nickname, title, company, and maybe a short statement about yourself. And then you click on the Connect tab up here, and you can enter contact information, including your email address, phone number, and other address, and then you're going to click Save All.
All right. So that makes sense. We set up the profile. Katie, can you just show us the home page again and tell us about it?
Yeah, absolutely. So in order to get back to Chatter, I'm going to click Chatter up here on the top of the screen. And Chatter basically functions like a discussion forum, right? So where participants can post, their own and respond to others' ideas, questions, resources, files and links, as well as announcements. And participants can search Chatter for files, people, and topics.
You mentioned that a user can post comments or questions. How does somebody do that?
Yeah, so if you want to post a comment or question on Chatter, you're going to go up here to the middle of the Chatter screen, and you're going to click Post. And then a little pop-up appears, and you're going to type a message in the text box. So let's do a little example here. How have others enhanced access at their practices? And I just want to mention here that you can call out certain individuals if you want them to see your message. All you have to do is insert an @ sign and start typing an individual's name, and people will come up. So here I'm going to search and select someone. And then I'm going to want to figure out who I want to send this message to. I can include those who follow me or a group that I'm a part of. And doing that, you click A Group, and then you could search for the group that you would like to submit it to. I think in most cases here, participants will want to post their question at the moment to CPC Plus All, so all CPC Plus participants will get it. However, in this instance, I'm going to select the National Learning Network team here, and that's where it's going to go, and then I'm going to click Share. And then you can see here that it's been added to your central Chatter feed.
This looks like a great informal learning opportunity for folks to leverage other people's experiences. If someone wants to share a file or a link that would be helpful to others, how do they do that, Katie?
Yeah, so you can share a file or a link, kind of similar to the place where you do post. You can click File or Link up here at the top. And here, let's click a file. And you can actually share a file from Chatter, or you can upload a file from your computer. Let's do an example and upload a file from my computer. So we're going to click Browse, and then that's going to go over to your computer here. Yep. And I'm going to select the implementation guide here. And then I'm going to want to say something about this particular resource for people. And then again, you're going to want to select who is going to get notified of this particular document, my followers or a group.
So a similar process as before.
Exactly. Exactly.
All right. That makes sense. Thank you so much. I see a library page here. Can you tell us what that is about?
Yeah, absolutely. Just wait until my my one resource loads, and then I will get over to the library. So just one moment.
Sure. So this is very much, there we go. All right, go ahead.
All right, perfect. So up here, similar to when we were going with Chatter, we're going to click the Libraries tab up here. Okay. And the CPC Plus Connect library basically stores all of the resources available to participants, including those provided via email, webinars, and newsletters. Participants can search for, upload, and download documents and resources that they find in the library and post them directly to Chatter, but cannot upload documents directly to the library. Also, in the library are content packs, which are collections of related documents or files which make it easier for participants to find what they are looking for. So, for example, if you wanted to review an old newsletter, there's a content pack that contains all newsletters that we've provided to date.
All right. I see a whole bunch of different things on the screen here. Can you walk us through the various elements of it?
Yeah, happy to. So there are three main sections of the library screen right here. So the first section is the top content over here on the left-hand side. And this section includes summary content activity within the CPC Plus Connect library. Within this list, participants can click a file to download and open associated details about that document. And then under the category drop-down menu over here on the top right of that section, you click that little down arrow, and then you can search by publication date, number of downloads, rating of that particular document, or number of comments on that particular document as well. The other section I would highlight here would be your popular tags up here in the right-hand corner. And this is where you can see the more popular tags or keywords associated with documents within the library. So the larger the size of the tag or keyword, the more popular it is. And participants can review these tags alphabetically or by popularity by clicking on the relevant button here. You can see sort alphabetically or sort by popularity. The third section I'd like to highlight here would be recent activity right below popular tags on the right-hand side. And this shows a snapshot of the activity within the library, right? So that includes the most recent files added to CPC Plus Connect, content that you've subscribed to, and newly published content.
A lot of different ways to access information. What if someone wants to search for a specific resource around a specific topic?
Yeah, great question. So if you want to search for a specific topic to quickly find something, you go over here to the left-hand side, and there's a section called Content Search, and you can type in what you're wanting to look for. So I'm going to put implementation here. And I just want to note here that for those CPC Plus participants that are also CPC Classic participants, they'll need to select CPC Plus Connect from the drop-down menu here. So up here it says All Libraries. You'll click the downward, and then you'll click the CPC Plus Connect button here, and then you'll click Search. Your results come up, and then you can, search through and click on a document and go from there.
So that's an easy way to catch up. Yeah. Go ahead.
Oh, I'm sorry. If you would like to receive notifications on a particular document when it's updated, you just click on the document like I just did, and you would click the button Subscribe here, and you should get a pop-up that says you are now subscribed to this content.
That's nice. That's very nice. I like that a lot. Katie, there is a calendar feature I'm seeing at the top there. Can you take us over to that and talk us through that?
Yeah, absolutely. All right, so let's click on Calendar up here in that top tab again. So the calendar contains all CPC Plus learning events and deadlines in a given month in a calendar view. Additionally, I'd like to say that you can view events in a list view, and you could subscribe to event updates that are of most interest to you. So to do that, to see a list view, you're going to click the first icon over here on the right-hand side. So let's click that. And now you can see a list of all events in order of date. And then I'm going to click calendar again. And to do the subscribe, you're going to click the third icon over here with a little check mark on the right-hand side. And you can see you can subscribe or unsubscribe to those updates. So you just press the button and it'll go off, or press the button and it'll go on, and then you close.
Very nice. Very nice. I like that feature a lot as well. Are there any other features that will be available in the future for practices on CPC Plus Connect?
Yes. So coming soon on CPC Plus Connect will be CPC Plus Connect Action and Affinity Groups. And these are informal online groups that consist of small cohorts of CPC Plus practices, payers, and or health IT vendors that have a common characteristic or need. So these groups are still being established, so be on the lookout for more information on them. Additionally, we're going to have a knowledge tab that will display FAQs to the community. And this includes FAQs already provided within the newsletters, as well as any future FAQs that are developed. And they're going to be very easily searchable. And more information about them as well will be provided.
Fantastic. I was reading through the CPC Plus Quick Tips Guide, which walks through how to get up and going on CPC Plus Connect, and it talks about a poll that users should take. Can you just walk us through how to find that poll when it is available?
Yeah, absolutely. So we want to hear from participants. So we're going to go over here to Chatter. And for this particular webinar, we've included a demo poll. So note that this is not the poll that you will be asked to complete. But what you're going to do is you're going to click on Chatter, and you're going to go through your feed, and you're going to find the poll. So here we have a poll here. Can you complete this test poll? And I've already voted, so I'm going to change my vote. But essentially, yours will be clean. You'll have your options already available, and you'll review them, and you'll choose one of them. I'm going to click no since I already had yes, and then I'm going to click vote. And then you can see that my vote was already automatically tallied.
Okay, so they'll be able to find that and see that pretty easily in their Chatter feed when they log on. That's fantastic. Katie, thank you so much for walking us through this site. I very much appreciate it.
You're very welcome.
If you can give me back control of the screen, Matt, that would be, and we'll continue. There's a couple of takeaway points I want to just refresh as we talk about next steps from CPC Plus. And just let me pull up the deck here. Here we are. So access CPC Plus. Look for that email notification that's going to be coming out. Remember, you have 24 hours to respond to it. If you do miss that 24-hour window, you'll need to contact the help desk to reset your account. The second thing you need to do is complete your profile. So personalize your profile, information about yourself and your contact info into Chatter. Next, you want to get to know the CPC Plus calendar and hear those upcoming events that may be of interest to you, the webinars, the office hours, the group events, all of those. And finally, when you do log in, take that first poll about your CPC Plus experience so far, and you can locate that in your Chatter feed. So now I just want to quickly walk through a couple of resources that are available to you that support the CPC Plus Connect site. The first is the Connect Getting Started Guide, and both of these are available for download for you. And just very quickly, the Getting Started Guide provides instructions on how to log into CPC Plus Connect and reset your password, request access for new users. So a very easy guide that will get you through some of the basic pieces. And then the other document is the CPC Plus Quick Tips. This just outlines the first 4 activities that are recommended that you can do now when you have access to CPC Plus Connect, which are logging in, setting up your profile, checking out the calendar, and completing the poll. So I want to spend just a couple minutes talking about what's coming up next in our events. We have several webinars that are planned for our CPC practices. and you can see the schedule in the first quarter here. Just to note that the care delivery series of webinars are bolded and italicized, the next one being the care management on February 2nd. So this event will provide you with a very complete look at the care management comprehensive primary care function. And then note that we have office hours every last Thursday of each month, and the first one will be actually on January 26th, which is tomorrow. So you can feel free to attend that as well. So at this point, we've reached our section for our Q&A, and we'll use several minutes of our time to answer the questions you have submitted. If you have questions that we're not able to address today as part of this Q&A session, please reach to the CPC Plus support team or bring them to the office hour tomorrow on January 26th. So CMS, do we have some questions we can answer?
Yes, so we've gotten a lot of questions about when will I get my access. I submitted my request a few weeks ago, and I still haven't seen anything. So thank you for your patience. We are still working on migrating and processing all of the new accounts and making sure everyone is associated to the right practice IDs. So they should be available this week or next week, and there is quite a backlog, so we appreciate your patience and flexibility, and we are working really hard to try and get the portal to everyone as soon as possible. We've gotten a lot of questions about the attribution and beneficiary report. So first, can it be exported? Yes, it's an Excel file that you'll be able to download from the portal. When will it be made available to us? It will be going into the portal within the next 2 weeks, so you should be able to download it for Q1 shortly. Will the patient panel report also show patient attribution by individual provider or only by practice site? It will only show attribution by practice site because our CPC Plus attribution and payments are all driven at the practice site level. We do not do provider level attribution. Another related question, can you clarify the fields that will be in the individual attribution files? And will the HCC scoring be applied to each patient? So the attribution file will include the beneficiary name, their health insurance number, demographic information, and certain other services. I don't have it in front of me right now, so and there's a lot of them, so I can't list them. But if you send an email to CPC support, we can give you the comprehensive list. And you'll also, again, be able to download the actual file in a few weeks. And then will HCC scoring be applied to each patient? Yes. HCCs are risk scores that are applied to every CMS Medicare fee-for-service beneficiary, and so that is what we use to determine our care management fee payments. Now I'm going to shift to some more questions about quarterly reporting. So when do we have to start reporting? In March? Yes. So the quarter one reporting will cover the period from January through March. And so there is reporting for the first quarter, which is a different question we got, but you won't have to do it until March, and it will be a retrospective look back over your first quarter in CPC Plus. Another question about attribution, is there a way to remove patients attributed to our practice because they see a specialist in the practice and do not see primary care? No, we're unable to change our attribution, which is based on a retrospective claims look back. We do recognize that our attribution may not be perfect. It's used as a proxy to pay you to support your practice transformation for all of your patients. If you think a patient is erroneously attributed to you, then we can work with you on a one-by-one basis, but it's likely because they're showing up in historic claims. But we refresh our attribution every quarter. Some more questions about the staff roster. So why are we entering our staff rosters, and who should we include? So the staff roster will include clinical staff of your practice who are not billing practitioners. So these are MAs, nurses, social workers, LPNs, that kind of thing. This is really important for us to inform our learning and our evaluation. We drive our clinician and staff surveys, which are very critical for the evaluation off of this roster. It's a requirement of your participation agreement to keep this up to date within 15 days of staff changes. We are a residency program. Where do resident physicians go on the rosters, practitioner or staff? Medical residents will go on your practitioner roster, and that is one of the questions on the Add Practitioner form as well. Can you please repeat the different ways to report ECQMs? So again, ECQM reporting will happen in the beginning of 2018, so you have a year to prepare. There's two ways of reporting. One is attestation, and that is where you'll go into the portal to the tab that I showed earlier today, and you'll manually enter those numbers. The second method is submitting information directly from your EHR to CMS using a QRDA3 file. We call this electronic submission, and you should work with your EHR vendor directly to learn more about this method and if it's an approach that you want to use. And now I might pass it off to Telligent. I know they've gotten a bunch of questions as well.
Yes, we can definitely go over some questions that have been directed towards us here. At this point, we are, if people are looking to add new users to the portal there, at any point of time they can go ahead and request that to us here. They want to contact CPC support. Please have the point of contact from the practice do that if possible for Plus, and make sure that they're giving us the practice IDs that are associated with the CPC Plus account here that they need to be put in there. Yes, and please make sure to include their EIDM ID so we can associate that with the correct practices. At this point, if you're not seeing a CPC widget to launch the CPC web application, CPC Plus web application, we want to make sure that you have applied for the practice user role, and that way that should associate that and associate you with that widget, and you should then be able to go ahead and click on that to launch that as you've seen through this WebEx. You may need to log out and log back in to make sure that that widget does reappear after you've requested for those roles once it's been approved. If you're looking to have more than one role per user at this point, that is not acceptable in the program here. That will cause issues with reporting. So at this point, please do not request for more than one role. If you do want to go ahead and submit portal access, please make sure, again, to contact CPC Plus support regarding that. We will definitely be working with you as fast as possible to get your access granted for you. It may take some time, though, depending upon the requirements that we have and the information that we do have. So please make sure to have your practice ID and point of contact information available. So please make sure when you're applying for that you're listing the current point of contact for the practice so we can associate that with that application if possible.
And if the point of contact wants to have access to the practice portal, they will need to include their name and EIDM account in that list that is submitted to CPC Plus support.
Correct. So if there is no application at this point to go ahead and choose, we definitely want people to be contacting our Plus support regarding that. There may be some issues regarding their current access that they do have, and so we will be working with people to make sure that they have requested for the correct roles. At this point, make sure that the formatting when you're submitting the list of users, that you're including basically the point of contact information, and they can go ahead and do this for you on your behalf to make sure that that information is entered there.
Those practices that are currently in CPC Classic, you do not have a separate account to log into the CPC Plus practice portal. As Janelle said, you'll be toggling between those two once you access the portal through the widget. Right now, we do not have all of your accounts associated with your new CPC Plus practice, and so You won't see that right away, but there is no need for your practice point of contact to submit a list of practice users to be associated with your new practice IDs. If there are additional users that need to be associated to those CPC Plus practices that do not have access to CPC Classic, then those need to be submitted by the point of contact, including the information that was distributed and identified in the newsletter in the last couple of weeks.
If anybody's having issues with their identity proofing process through Experian, through the online method, they may be prompted to then go to a phone method to prove their identity. If you're having issues at that point through the Experian phone model to get your identity verified, you will need to contact CPC support or CPC Plus support to make sure that you're getting a manual identity proofing form. I know several of you may have already submitted that request. If you're having that issue, just please wait and be patient on that, and we'll making sure that those forms will be out to you as soon as possible. They will need to be signed, notarized, and mailed back to CPC Plus support directly. Unfortunately, those will not be able to be faxed or scanned in to us here.
And just to make sure everybody understands, that is only for those individuals who have failed the online identification proofing process as well as the follow-up phone identification process. So no forms are needed unless you've actually failed that identification proofing process. One of the other questions was around reports and if you can print pages from the practice portal. And I think Janelle alluded to some information around the attribution and payment types of information that are available for viewing in the practice portal. Within the report section of the portal, you will have the ability to download those financial reports, and so that you can have those available for sharing within your organization.
We also had looks like another clarification question regarding how to toggle from the Classic side of the program to the CPC Plus side. Again, where that payment year is, when you kind of were looking in the model before, there should be a toggle ability for those who are in the Classic side to flip from the Classic to the CPC Plus. If you're having any issues with that and you're a Classic user, please go ahead and contact the CPC Plus support, and we'd be happy to assist you with that.
Janelle, I think that covers all of the questions that we've had so far. If there's others that you'd like to address?
This is Bruce Allen. There was a question of will participants be able to register for events through the calendar on CPC Plus Connect? And yes, there is a link that is put in the registration link, and you can copy and paste that into your browser for registration. There was also a question of whether the CPC Plus calendar can be linked to another calendar, and you can't do that, but when you register for your event, a Outlook calendar reminder is provided to you, and you can add that to your calendar that way. And finally, if you have problems accessing any of the slides today, we will be sending them out with the newsletter that comes out later this week, so you'll be able to have access to them.
We've also had a question about if you are associated with multiple practices, if that's a possibility. So the answer is yes, and hopefully this makes your life a whole lot simpler. You will just have your one ID used to log into the practice portal for CPC Plus, and then you'll be selecting which practice you would like to be viewing the information for. So for those of you who are in Classic, you'll have those two tabs, plus you'll be able to identify which practice in each of those programs that you want to see. Now when you submit the user list, the point of contact for each of those practices needs to include your name in that list. So sometimes those points of contact may not be the same, so make sure that if you want to have access to multiple practices, that those points of contact understand that and they include you in that list. That's one of the checkpoints that we have, and that's why we ask you to include the list of practice IDs that you would like to have access to, so that we can do a comparison of what you are expecting to get access to and what your practice points of contact have authorized.
And it looks like there was maybe another question as well, is essentially where would these approval or request emails be coming from when things have been processed? At this point, it should come from a no reply at cms.hhs.gov. So whether it's been approved or rejected, you should receive some type of notification through there. If it has been rejected, please make sure to review the information that's in there on how to submit a new request.
There was a question of where the recording will be posted, and right now they're posted to the CMS YouTube channel, and they will also be posted to the CPC Plus Connect site.
We've also had a question around clarification of who is the point of contact. So within your application submission, there was an application point of contact and a practice point of contact. Either one of those individuals can submit the list of users for access to the practice portal.
In the last 5 minutes, I'm hoping that we can get some technical questions answered by ActionNet about CPC Connect.
Yes, we're prepared for any technical questions.
So there's a question about access to CPC Plus Connect. The question is about password. It says that tells the user that the password is incorrect and have to get it reset, and the email takes 2 days to be returned with a new password reset. Is this normal?
So it depends. If the request was sent through the help desk by emailing the help desk saying that the password needs to be reset, it actually goes in the help desk queue, and we actually have our help desk users that manually address each case. So if there's a gap between when you're actually submitting the need for a password reset and the actual password reset email being sent to you, then it is probably because the help desk has gotten to it. However, if you select reset password on the login page, it will actually send the email notification of the password information to you in real time.
So another question, so if a provider leaves mid-quarter, will this affect the quarterly payment? Yes, it will affect your future quarter's payments, not retroactively. Another more general payment question, when will we receive our first payment? The question on everyone's mind. So the first payment will be going out the door by the end of this month to a portion of the practices. Some practices will not receive their payments until February or March due to processing lag. Another more general question related to beneficiary notification. How do we notify CMS if a patient does not want their personal health information shared? So the beneficiary can either call 1-800-MEDICARE or you can file that with CPC support. So we have 4 more minutes, so I guess we will wrap it up. Charles, did you have closing remarks?
Yes, thank you very much. Thank you, everyone, for submitting your questions. We very much appreciate you taking the time. Again, we will provide the slide for today's deck in this week's newsletter. And we know you're very busy. We want to thank you again for taking the time. If you could please take a minute to complete our survey. Matt, if you could launch that. Your feedback is really important to us. We're trying to improve these events as much as we can and make them more meaningful to you. So if you could take just a couple minutes to fill out that would be fantastic. With that, I just want to formally close today's webinar. I hope everyone has a fantastic rest of the day.
Ladies and gentlemen, thank you for participating in today's webcast. This concludes the program. You may now disconnect.